200. Clear.
Andrew.
Gauge is in VF. Shock 200.
No pulse.
Clear.
Get a milligram of
Still
adrenaline
VF.
ready, please.
I'm setting 360.
No pulse.
Clear. P waves bearing no relation to ventricular
We gap,
complexes.
but needs
He's
a
in
pacemaker.
third degree block. You going to be alright while I call the boss?
Safe as houses, mate.
Okay. Successful cardioversion following VF arrest, now stuck in third degree block with severe hemodynamic compromise.
He needs a temporary pacemaker.
Yeah, Dr. Turner, I'm afraid I've only ever seen it done once.
Then you've seen one.
Look, Claire's not on call tonight, and I'd feel more confident if I was supervising this procedure.
Have a go. You'll be fine.
Yes, Dr. Turner.
Forgive me. Clearly, a 3-month waiting list is intolerable. But, privately, this is something we can do next week.
There's been a distinct lack of a mess party recently.
Oh, CCU had a night out last week.
Good.
Hardly anyone went.
Isn't it time for the docs to put on a do?
Yeah.
Heparinized flush, is that okay?
Yep.
And a feeder cath?
I'm fine with everything the way you're used to it.
If there's something you're not happy with, please do say.
No, everything's fine, thank you. Mr. Gibson, the first thing I need to do is to clean this area with antiseptic, okay?
You'll be putting the drapes on, won't you?
Yep. Just getting ahead of myself then.
2% okay for you?
Oh, Lignocaine, yeah, fine. Like I said, everything the way you're used to it. Okay, Mr. Gibson, I'm going to give you an injection of local anesthetic. I'm looking for one of the big veins that run towards your heart. Ah. There. Okay, Mr. Gibson, the next step is to run a wire down the tube into your heart so we can then pass an electric current down that wire and control your heartbeat. I need the
wire?
Yep. The wire. Okay. Screen, please.
Doc, we've pumped a lot of rays into this chap.
Mr. Gibson, I'm having trouble getting the wire in exactly the right place to create a good heartbeat. Please, bear with us.
Andrew, isn't it time to get some help?
See if you can get Claire. She used to go out with that surgical registrar, Smedley. If he's on call tonight, he might be able to give us a phone number.
His rate's dropping. 25. 20.
Okay, let's connect the box up, see if we can get capture.
Five at 80.
Whatever. No capture, let's go to external pacemaker. Get me 10 milligrams of diazomils, please. Could you give me a hand? Thanks. Roll him on his side of 3. 1, 2, 3. Okay, Mr. Gibson, we're gonna control your heartbeat from the outside. We'll give you a sedative so you're not too uncomfortable, okay?
Let me see. Picture, please. I reckon that's about as close to the RV apex as this wire's been tonight. Okay, let's have a go. Set 2 millisecond pulse, rate of 80, starting at 2 volts. Discontinue external pacemaker. Pace, please.
Pacing at 1.5. Pacing at 1.0. Threshold at 0.8.
Set 0.9.
Thanks, Claire. I'll see you to the wife here. Thanks.
Dr. Maitland, do I smell alcohol on your breath?
I wonder if you could do a blood alcohol level for me, please.
What?
Me, actually. I might have to prove that I've had no more than a sip of wine tonight.
Send it down.
Thank you.
Something's got to be said, Claire.
What? Challenge the consultant's right to do private practice when he should be here? There's a hurricane in Florida. Why don't you go over there for a piss instead?
I tried calling you last night.
Your wife otherwise engaged, I presume?
Yes, Charlotte was at her mother's. I got to thinking, Claire and I haven't seen each other for a bit.
Get used to it.
What are you saying?
I'm saying, how can I break this to you gently? You're chucked, dumped, jilted. You've become a letter of the alphabet between W and Y.
What brought this on?
Kind of answers the question, really, doesn't it?
Oh, come on, Claire. Don't tell me you've got a man.
Adrian, there's a first time for everything.
Tell Scissors I'll see the patient at lunchtime, and in the meanwhile, an ECG and a chest X-ray would be greatly appreciated.
Dr. Mortimer, can I have a quick word?
Celerity.
I wanted to get a comment for the evening edition. One of the hospital governors has described your condition as an immoral disease and described the decision to keep you on as madness. Well, as you know, the hospital is back testing on your patients. And what's your reaction to the widespread panic that this has generated among members of the public? Some patients say you're putting them at risk. They say all doctors should be tested for HIV and ones like you should be kicked out.
I'll go along with that as soon as they start testing every bastard who comes through that door, asking for our help.
Since Mr. De Vries regards this car as an extension of his penis, I doubt you can begin to contemplate the seriousness of your crime.
What shall I do, Mr. Doherty?
Exercise the better part of valor, my boy. Eh? He who squirms and runs away lives to squirm another day. Piss off.
Just look at it.
I fear you suffered a frightful misfortune, Adrian.
You didn't see anything, did you, Ernest?
I fear the old peepers aren't what they used to be.
I'm pleased that the patient is faring well. I must pass on my thanks to Claire. Good experience for you too, Andrew. I recall the prof in a waggish moment, defining experience as the quality one gains just after one has most needed it.
Well, Dr. Turner, with all due respect, I do feel that there is some cause for concern.
Oh? Regarding me, do you mean? Andrew, do you have an observation to make? You have a complaint regarding my availability on call, yes?
Yes.
Then you've already made it. Your designated channel of complaint is through your consultant. Your consultant is informed. Your consultant will act accordingly. Your involvement in this matter ends herewith. Thank you for bringing your concern to my attention.
Oh, Andrew. I've spoken to Luke.
Luke? Oh, yeah.
He and I slept together last year.
Well, I did kind of realise.
He's HIV positive. I have to have a test. And I'm telling you that you need to have one too.
Do you want to get some brekkie?
I don't know.
Go on. All right, I promise I won't dip my soldiers in my egg this time. Is something wrong between you and Nazreen?
Worse.
Worse than woman trouble. A motor then?
Conference.
Breakfast.
You know the difference between you and Elvis? You are definitely dead. As if he'll ever find out.
Yeah.
Rajesh?
Can't pay, won't pay. What a perfect example of the welfare state you are.
I can't afford to lose my no claims, but I can't lay my hands on the cash either, Mr. De Vries. Please don't make me beg, Mr. De Vries.
I think I'd rather like it if you were to beg.
Student overdraft.
Rent, bills. Nazreen, my girlfriend, she's in the police. She'll kill me. Oh, please, come on. You're not even very good at begging, are you? You have 2 days leave coming. We're short of a locum and a private wing. Your earnings will pay for the jag and calm my jangled nerves.
I was hoping to use the... I'll be there bright and early tomorrow morning, Mr. De Vries.
Good day, madam. We're waiting for today's PT, are we not?
The house must have sent it off, Mr. Doherty.
Thank you, sister.
Your drip's through. I'll take it down for you. Ah!
You all right, sister?
I think so. One of the doctors must have forgotten the needle.
Oh, that's right, got it to bleed. That hepatitis is still communicable.
I'm sure it's nothing to fret about. I'll get someone to take your drip down.
Come on.
No, I'm going to be late back, I'm afraid.
There's something wrong, isn't there?
Alison, nothing's wrong. I'm just on a late ward round, okay?
Okay.
Okay.
Still here, Andrew?
Yeah, Dr. Turner's been called to see a patient.
Of the paying kind, I assume. Yes, Claire told me about that. I deplore Graham Turner's action. Off the record, it's a practice that has not gone unnoticed by management. Watch this space.
This, tinnitus of mine. I didn't catch a word.
Tumour, I'll be bound.
What am I going to tell Alison? We can't have sex for 6 weeks and then you've got to have a blood test. Why? Oh, no particular reason.
Well, maybe this is what was needed to bring it out into the open. We've got a problem. We have to support each other. Yes.
Claire?
You'll never leave your wife, and maybe it's about time I gave up all these shallow, pathetic...
No, Claire.
Adrian, never argue with the referee. You see red card, take an early bath.
Claire, I am not interested in trivia at a time like this. I was hoping I could have a lift.
Oh, Adrian, I'm sorry. Yeah, of course.
Oh, delivery's out the back. Sorry, Andrew. Liz hasn't answered a bleep. Pulse rate 30 to 40, blood pressure 110.
He's gone back into complete heart block. There you go, Miss Gibson. If it happens again, just try clicking up the voltage.
I don't think any of us would be happy doing that, Andrew. This isn't coronary care. While you're here, can you have a look at Mrs. Pandit? Her urine output's been under 30 for the past 2 hours.
Okay, quickly then.
This is your on-call room. You've got your own television with satellite channels. If there's nothing on, you can always use the video. We've got loads of tapes. Have you seen Jurassic Park?
I work in it.
Oh, we don't mind you using the phone for 1 or 2 personal calls, but keep it local.
So, where do I pick up my bleep?
Bleep? It's rare there's anything to do. We'll just come and knock you up. Oh, do you prefer tea or coffee when you're called out? I don't know how bad the infection actually is. It's more of a medical matter. And I haven't got the result back yet.
Claire, I got tired
Actually,
of
the
all belong.
doctor might know. If you can just bear through.
If our output doesn't pick up, can you have another shot, please?
Okay. Andrew, can you have a word with Mr. Reynolds, please? If you'd just like to take a seat in Sister's office, please, Mr. Reynolds. It's like ward problems. See what happens when we don't help each other?
Naturally, I'd like to extend my sympathies, Sister. This must be a worrying time. How are your family taking it?
They're concerned, of course, Mr. Tennant. It's not knowing whether I'm going to get the infection or not.
Quite. Well, to business. Yes, I'm afraid I've had to decline your request for sick leave. This is in line with hospital policy. However, you have been directed to observe safe practice until you receive a clean bill of health.
And the question of compensation?
Well, it is deemed your responsibility to safeguard your health in the workplace. Read this. Why not try a claim against your colleague whose negligence caused this injury?
The operative word is colleague, Mr. Tennant.
Mr. Tennant.
Mr. Doherty, I was happy to accede to Sister Lander's request for you to be here. But may I remind you that you have no mandate to interfere in my day-to-day management of this hospital's affairs. I insist on all comments being made through the chairman of the Consultants Committee.
Graham Turner.
Indeed.
And please don't forget to raise the head of your bed at night. And lose some friggin' weight.
Sorry, Claire.
Looks like someone's going to get their comeuppance. They're auditing which doctors actually attend clinic sessions.
Gotcha.
Good morning. Sorry I'm a few minutes late. Traffic doesn't get any better, does it? Well, Claire, looks as if you'll be spared covering my clinic after all.
Good morning, Graham.
Morning, Paul.
Just thought I'd ensure the audit got underway smoothly.
Mr. Tennant, may I ask who knew about this audit in advance?
Only my staff. And, of course, the Consultants Committee. Which reminds me, Graham, the committee luncheon will be at 12:30 today.
I'm sure the caterers will do us proud as usual, Paul. Excuse me. Yeah.
Well, I can't leave my list of our anaesthetists off sick, can I? Let's see first if we can find someone who won't go whinging to the newspapers. Shall we?
Dr. Mortimer, I am annoyed, to say the least.
Stuck on the crossword again, Mr. Tennant.
I've frequently been appalled by Graham Turner's refusal to accept consultant responsibility.
The very person the audit was designed to catch out.
Sarah, wouldn't you agree? If Graham remains chairman, it does us all a disservice.
Mutiny, Ernest?
Oh, yes.
Alison, can we not talk about this at work?
I don't speak to you otherwise.
Well, I'm sorry. I'm sorry about the way I've been recently. I'm sorry about last night.
I want us to get help.
What are you talking about? You saying marriage counselling then?
Yes.
Oh, this is definitely something I can't talk about now. I'll see you tonight. Okay. Oh, God.
Steak au poivre, French fries, onion rings, button mushrooms, carrots and green beans. Black Forest Gatto for dessert and a selection of cheese and biscuits. I do a mean Irish coffee if you fancy.
Yeah?
Anything on the telly tonight, Doc?
Oh, the usual crap.
Then might you be interested in one of my special videos?
I'll ask Dr. Hudson to put him on a pacemaker list for tomorrow afternoon.
Mr. Gibson, we need you to sign a form.
Dr. Maitland, may I have a word with you, please? I have just received a very serious complaint.
Oh, you're the fellow who saw me over the other side when I had my heart attack.
That's right, Mr. Crichton.
Brigadier Rocha, I'm pleased to report the misunderstanding with my private health insurers has been overcome. There's no danger of slumming it this time.
No, Brigadier?
My daughter, due to arrive any minute. I wonder, would you mind putting her in the picture? She's never satisfied with my answers. Tends to fuss, you know.
That really should be left to the consultant.
No.
Hello, Daddy.
Hello, dear. There we are. Right.
Julia Crichton, how do you do? Doctor?
Hello. Perhaps I should explain what's going on, just to put your mind at rest.
Thank you, Doctor.
What operation have you had done, Brigadier?
Oh, Doctor.
What can I do for you?
Oh, I'm very grateful for your speedy intervention. And I just wondered if I could thank you by taking you out to dinner tonight.
I would love to. No, I really would. But I've got to go out with my girlfriend tonight.
Oh, I feel a real fool all of a sudden. I'm not normally the one to make the first move.
It's always drought or monsoon with me. I go months making do with watching Baywatch videos. Then I get a girlfriend, and then I get asked out by a beautiful woman.
I know you don't mean it, but you're very kind. Anyway, thank you very much.
Bye-bye.
Bye. Well, I feel a bit mean, actually, because he seemed really sweet.
Oh, believe me, Julia, at the moment I need any kind of laugh that I can get. Thank you.
I have just received an anonymous letter alleging that you were drunk on duty. Now, usually these charges would be impossible to substantiate. Remarkably, however, a blood sample taken at the time shows an alcohol concentration in the blood more than twice the legal limit for driving. You are suspended, pending further investigation.
I'd like to make a statement, Mr. Tennant.
Go ahead.
You need a stronger deodorant.
15 quid I paid for this.
Hey, you're onto a good thing here, though, mate.
What a downer any consultants can do private practice.
I can't believe you blew out that brigadier's daughter. She was such a babe.
Nazreen says labels demean women.
Yeah, but she's a feminist, though, isn't she? The sort who'll suck your knob but won't iron your shirts, because that's degrading.
All right. It's my sister. It is. Had you there, mate? You're so gullible. Never catch me being had so easily.
Are you looking at the pacemaker chest x-rays today?
I suppose I'll have to, won't I, since Claire's been suspended, since someone reported her. Maybe that someone should remember that a patient might have died, if it wasn't for Claire. So have you made arrangements for the HIV test yet?
Not yet.
It's scary, isn't it? I know. Anything I can do? I mean, the sooner you have it, the sooner, the worrying's over. Caroline, I was thinking that maybe you could have your test, right, and then...
I will.
Soon, please.
Ah, I see.
I know it must sound heartless, but... You see, I've still got to wait for my test to allow time for seroconversion after exposure to the virus. If you've got it, your test will already be positive. And you're my only potential source of infection. So if your test is negative, I don't need one.
Your wife neither. I suppose it's asking too much for you to show a scrap of concern for what this means to me.
Caroline, please.
You tell your wife about us. I'll tell you my result.
Namaste. Vinay,
राजेश बोल रहा हूँ इंग्लैंड से।
कौन?
राजेश इंग्लैंड से।
कौन बोल रहा है?
No, nothing. Don't fuss.
He's had chest pain, partially relieved by GTN.
Can we do an ECG, please?
It's Raj. He reckons one of your PPs has had an MI.
What the bloody hell am I supposed to do? Sew this one up, half finished.
Patient's had a heart attack and his consultant's busy in theatre. He needs proper emergency care. I'm transferring him back to the NHS.
The black hole of Calcutta, here I come.
Our image in the community is already rock bottom, and we were this close from another catastrophe. Now, if your private practice is so important, maybe you should give it your sole consideration. But Paul... Of course, Graham, if you were to give up your NHS practice, other clinicians might think that you weren't keeping up to date, and private referrals would dry up. Now, this administration appreciates our consultants' hard work and respects your interest in the perquisites of private practice. But please, do not stray from a happy medium.
I think we understand each other, Paul.
Good. Of course, Dr. Maitland's suspension will be rescinded. A doctor can't be drunk on duty if she wasn't actually on duty. Odd, though, that she should go to the trouble of giving a blood sample if she knew that it would prove her guilt rather than her innocence. Almost as if someone had wanted me to delve into this incident.
No one's that clever, Paul.
You've had a bit of a scare, Brigadier, but everything's under control now.
Yes, it looks pretty steady.
Nice touch, I thought. Blaming the nurse for the letter.
Turner's secretary said he's facing the music now. Word is, Tennant's going to have him filling out timesheets from now on.
Oh, poor Graham, my heart bleeds. Come on, let's go and help Dr. Hudson with his pacemaker.
Yeah, listen, I'll catch you up, all right? Won't be long.
Ernest?
Hi, Graham. I do hope this isn't a bad time. I have decided to stand for the position of chairman of the consultant committee. Nothing personal.
Hello?
Alston. There's something I've got to tell you.